so that people can feed their kids if they need to or themselves before the evening's through. We're lucky to have Meg Burke Dingae, if did I say that right, Meg? Um,
Oh, there we
Director.
go. I was trying to
Yes,
unmute. It's dingy, but that's
Ding.
okay. It's really
Okay,
hard.
gotcha. Yes.
I'm
Uh,
um I'm not
yep.
sure if my video is not coming on. I don't know if it's something that you
Okay.
put on for me or not. Okay,
Normally that
I'll
would be
start my.
something on your end. A little. There you go. There
Okay,
you
there
go.
we go. I got it. Okay,
Awesome.
awesome.
Okay. Floor is
Great.
yours.
All right, awesome. Thank you, everyone. So great to be here. My name is Meg Dingy, and I am the director of our Human Experience and Digital Health Department here at Montage Health. And I'm excited to be back. I came last year to talk a little bit about our digital health program, which has evolved quite a bit over the last year. So excited to share a couple of examples of the innovation that we're implementing here at Montage Health. You can go to the next slide. And the next one, actually, too. Thank you. And so for those of you who aren't familiar with Montage Health, we are a collection of entities that began with CHOMP, our Community Hospital of the Monterey Peninsula. And CHOMP has roots back to 1929. And then more recently has evolved into Montage Health. So not a corporation that came and bought CHOMP, but instead just sort of an evolution to better support our community with other organizations like our Montage Medical Group, which is about a 90 physician multi-specialty group, our MOGO urgent care centers, Aspire Health Plan, our wellness centers, our new pediatric behavioral health center, Ohana, which you might have heard of on a news recently. We just opened our doors, and then our foundation. And you can go ahead and click to the next slide. And actually, we'll just skip right to the next one. And so this is our digital health vision. I won't spend too much time here other than to say that our vision is designed to support our enterprise strategies at Montage Health. And basically, we're just trying to knock it out of the park when it comes to making the experience easy and seamless and expected for our patients and our providers and staff and our community members. Next one. So these are our digital health big rock strategies, we call them. So the first is to meet our patients where they are. And the projects that are represented in that column really are, our on-demand telehealth program. So having patients have the ability to reach a provider 24/7, 365 using e-visits or chat with the doc are some examples. Remote patient monitoring, which we've made a lot of strides in over the last year, and we now have a pretty large RPM program for our Medicare patients that is focusing on supporting patients with hypertension, type 2 diabetes, and heart failure. So we send them the devices, and then we have a full clinical team who are monitoring the patients and making interventions when necessary. And then self-service tools, so things that you would probably consider table stakes in other industries, but I think healthcare is really now starting to catch up. But being able to schedule your appointment online or email your doctor, those types of things. And then leveraging innovative technologies to improve the human connection. And that's what I'm going to be talking about here in just a second. I'm going to focus on that. And that's things like using artificial intelligence and large language models to really automate some of the mundane clinical administrative workflows that humans are doing today, but don't necessarily need to be doing. So things like in healthcare, we get a lot of fax referrals. So referrals come in, someone's taking it off the fax machine and they're sitting down at their computer and they're typing all that same information right into our electronic medical record. So not super high value work, but very time consuming. And those are the types of things where AI is really kind of storming all industries right now to help out. And then building the program with our voice of the community member. So ensuring that we're engaging our patients in the programs that we're developing for our patients. So a quick example is we have our new Ohana Pediatric Behavioral Health Center. And we do focus groups with the teens there to talk with them about the digital health solutions, because as our CEO, our VP of behavioral health says, is teens really are digital natives, right? If you want to talk digital, talk to your kids because they know how to do all the digital things. So we sat down with them about a wearable device pilot program we wanted to do, and we plan to use iPhones and Apple Watches. And we sat down with them and just immediately learned that they were never going to wear an Apple Watch. So we had to pivot, and we're now looking at Oura Rings and Whoop as some alternatives. But really, just it's so important to actually ask the people who are going to be using the thing to see if they really would use that thing. We also just recently partnered with Press Ganey on a human experience platform, hence my new kind of subtitle of human experience. And really excited to use, to leverage more of the data that we have from our stakeholders, both staff and providers, patients and others, to make decisions to improve the experience across our organization. So that's kind of a new program that's happening now. So you can go to the next slide. Okay, sorry, this is a little bit blurry, but tonight I'm going to focus on that middle column I just talked about, or leveraging innovative technology to improve the human experience. So really focusing on artificial intelligence, and I'd like to provide some examples of how we're using it today at Montage Health. So I can't see a show of hands, but I'm assuming a lot of you have tried and played with ChatGPT. So you're familiar with generative AI and the huge strides that have been made over the last 18 months or so since it came into effect, ChatGPT. Which is natural language processing, and really AI, because of ChatGPT and other strides, has become more and more sort of human-like. It's getting a lot of press in all industries. I know our last presenter just referenced it in the travel industry, because of the opportunity that it has to create and supplement workforce strategies. So really taking over some of the tasks that, again, are mundane, like the example I just gave, that are done by humans that really don't need to be done by humans. So for this slide, Bain Consulting Group here did a survey of almost 100 health systems who reported that they're using AI or plan to use AI in the next 12 months for things like billing and charge captures, or helping to analyze and structure patient data. And then they're also reporting that over the next 2 to 5 years, they're planning to use generative AI for predictive analytics, or diagnosing conditions and recommending treatments. And you can go to the next slide. And actually, we'll skip one more. So I'm going to focus on one use case of AI, or artificial intelligence, that we've implemented here at Montage Health over the last year, and that's care gap closure automation. So care gaps in the medical world, if you're not aware of the definition, they're important procedures that a patient's due for but hasn't yet received. So if you're a woman of a certain age, you're supposed to get your annual mammogram. And if you don't get that mammogram in the allotted time frame that you're supposed to get it, then you have an open care gap. And care gaps are, of course, detrimental to patient care. If you're the patient and you miss a mammogram and then maybe you get lost to follow-up and it's been years, you could be at risk for some very serious clinical implications. And they're also detrimental to health systems because care gaps are quality metrics that are reimbursed by payers. So really important to manage care gaps better. It's a problem across the entire country. It's very hard to manage because many patients do get lost to follow-up. But essentially for this project,
17.
oh, I think someone might need to, do I sound okay?
Okay.
Yes, you sound okay. Marty, maybe Mary Jo, would you mind muting Marty's? Or there you go, Marty. Thank you.
Okay.
You're
I
good.
don't know if it was me. Okay. So care gap automation, the way we're using it here at Montage Health, it essentially we partner with a company, a technology firm called Notable, and they're using a combination of artificial intelligence and robotic processing automation, or bots. And these bots essentially are scrubbing through thousands of patients' charts in seconds. And they're reading and finding documentation of a care gap closure that may have happened outside of Montage Health. So maybe you had that mammogram somewhere in the community sent the report to Montage Health physician, it somehow got, oftentimes they get stuck into the electronic medical record as an attachment, and oftentimes get lost. And so bots can actually, again, thousands and thousands of charts in seconds, just search and find language of a test or a procedure and pull that out. And potentially close that care gap just based on that automation. Or if they don't find anything, the bot can automatically text the patient. That's what you're seeing on the right-hand side of the screen here, and say, hey, you're open for, you're overdue for your mammogram. Have you had that mammogram done elsewhere? If you have, then the patient can provide that information right in the text, and then we more easily can follow up on that lab report or procedure report. And if they haven't, then it invites the patient to self-schedule for their mammogram right from that text message. So a really good patient experience, and we're catching so many more patients because of this automation. So I'll go to the next slide and actually show you some of the outcomes here. So we have implemented this program, this intervention on 5 different care gaps: cervical cancer, colon cancer, breast cancer, diabetic eye exams, and hypertension. And to date, we have, and so this has been just this year. We just started implementing it. We did it, 3 months for cervical cancer. Then after that, we did colon. So it's been sort of a longer process. But in total, the bots were able to scrub 13,862 charts just in that year. And out of those, 1,606 total care gaps could have been closed just from the automation alone. And they could be closed in 2 ways. So that's the red box down below. They could either be closed via chart scrubbing alone. So the bots are just simply finding documentation and they're able to pen to closure in Epic. That's 7% of the time. Or 5% of the time, the patient is outreached and either provides information about the care gap closure elsewhere that we can follow up on, or self-schedules to come in and get, say, their mammogram or pap smear. So 12% of the time, we're actually doing this without much human intervention, especially when the bots are doing the scrubbing alone. So that's really exciting. It's saving a ton of time. I forgot to put the time savings on here, and I don't recall off the top of my head, but people were doing this before, and now it's done via the bot. So really exciting. The providers are super happy. They're not having to actually change anything, and their care gaps are getting closed. So a couple of exciting things is we're going to continue to do this for these 5 care gaps over 2024, and kind of look at the data, decide if we want to expand to additional care gaps. And also, we applied for an innovation grant from the Central California Alliance for Health, which I think I put the wrong acronym in here, but we actually were awarded a grant. So we're partnering with them to actually look at their cohort of Medi-Cal patients for this automation to see how we're improving access and engagement from that population as well. And you can go to the next slide. So next in 2024, we could head to the next slide too. So this is, and I'm not going to play the video for you because it's going to take a little bit too much time, but I will put the link to the video when I'm done with the presentation. So we actually just partnered with a company called Nuance, and Nuance is a clinical documentation company that's been around forever in healthcare, and they were recently purchased by Microsoft. So they've really just fast forwarded in the world of generative AI, and they have this new product called DAX Copilot. And what you see here is basically what DAX does is it listens to the conversation between a patient and a provider, and it takes all of that information and just in a human-like way, in seconds, it actually inputs the conversation, but the pertinent parts of the conversation, not the "Good morning, Mr. Trott, how you're doing," but all of the actually relevant information, and inputs that back into Epic so that the provider doesn't have to do that. They don't have to type while they're talking to the patient, and they don't have to do notes later. So really improving the relationship between the patient and the provider and putting that human connection back kind of in the forefront. And then one more slide. Another way that we plan to use AI, we haven't contracted on this yet, but we're exploring different AI solutions to actually respond to providers' in-basket messages. So if you have a portal that you use from your healthcare provider, like MyChart, for example, you might be able to email your provider. And providers get tons and tons and tons of emails from patients. And so they actually have something called pajama time because they're working at night trying to respond to all these messages. And oftentimes they can't respond to all the messages in a timely manner because there's so many. Well, generative AI can respond to patient messages in a human voice. And actually like for this example, if you see down at the bottom, new grandpa, this patient's telling the provider, "I'm a new grandpa, I'm really excited. She's adorable, but she's sick all the time and I'm really worried about my condition." And so the AI responds in a really human-like way saying, "Wow, congratulations, so great to hear about this," and also provides recommendations on the questions that the patient is asking. And I know this can kind of seem a little freaky, right? Because you want to make sure you are talking to your provider, but rest assured, for a lot of these technologies, nothing is happening without provider consent. So nothing would ever be sent from a bot or an AI solution without the provider fully reading it, adding in commentary, and sending the message. But we hear from our providers that, man, if somebody could just draft my emails for me and I could go in and look at them and make changes and then send it, it would take so much work off my plate. So we're really excited about this solution as well. And I think that's it. If you want to just skip to that last slide to make sure. Yeah, this is it. So thank you so much. I'll turn it back to you, Josh.
Yeah, that's awesome, Meg. I mean, there's so much going on with this the language models, and you can really see the utility of just those last couple examples that you showed. I think it's interesting that you're working on this contract basis to develop these applications that, if I presume there's some process, what's the process, I guess would be a question, for if there are entrepreneurs with solutions of interest that, is there a way that they might, um, you know, entertain your interest in them,
Sure.
or how does
Yeah,
that work?
absolutely. I mean, for me, it's really, attending industry conferences, understanding who the players are. We haven't done RFPs specifically for things, but it's just sort of word of mouth. I mean, I'm always happy to get a message or have somebody, get put in contact with me to talk through solutions that might be out there I don't know about. So that's kind of the process has been a little bit organic, but just finding the companies who are doing it right and testing and piloting.
Great. Well, it looks like you're doing a great job there. And yeah, I mean, wow, what an impact
Yeah,
so
absolutely. Yep.
all
Thank you. Thanks, everybody. I'll put that video in the chat so that you can
great.
watch that video if you'd like.
Thank you. Okay, folks. Well, we're moving along. I know there's a lot of information, but each speaker is just, I mean, got so much to say, and each of these segments, lots of exciting things going on for the Central Coast and for Monterey. So